Well, thank you so much for joining us. You've been pretty busy here at GP19. We appreciate you taking the time out now to just give us a few summary points, I guess,
Thank you.
from your presentation. So, Babylon, uh, what do Kiwis, Kiwi GPs need to know about Babylon?
So I'd say Kiwi GPs need to know that we are a health technology company doing some amazing things in lots of different countries, but all about trying to provide affordable and accessible healthcare for everyone around the globe.
What would you say to GPs who will say, well, that's wonderful, AI is a great tool, but it can be nothing more than that because primary care is about continuity of care. What's your answer to that?
So firstly to say AI is a great tool and it's very much something that can help improve care for patients. I think it can also really help improve the working lives of GPs. So the very same technology that benefits patients can benefit GPs. And I think in terms of continuity, there's no reason why we can't achieve continuity in a digital service. It just needs to be done in a different way. But of course, we all know the benefits of continuity of care. And we wouldn't want technology to displace that in any way. So this is about augmentation rather than disruption, which is a term that's often used. And I don't really think that's appropriate for healthcare personally. I think actually being able to augment and support existing healthcare systems and existing structures that people have worked very hard to build is really important.
Yeah, I think it's a good point you raise. So one other point, and this is from a Aotearoa New Zealand perspective,
Okay.
is about the special character of this place and the importance of placing a cultural lens across one's practice in New Zealand. Specifically, I guess I'm thinking Māori healthcare and health inequity that has affected Māori here in this country for a very long time, and of course other cultural groups. How, as a GP, are you going to work through those cultural issues that often appear in a consult?
Sure. So I think the key here is engagement. So we have our service deployed in many different places, so very developed settings like the UK and Europe, but also developing country settings like Rwanda. So we had to do a whole series of engagement with community leaders, church leaders, local clinicians, with local groups such as the Umaganda group, which is sort of a clean-up group across the city. And so through that process of engagement, we could really understand what it is that would address the needs of the local population. And I think there's no reason why something similar couldn't be possible here if people wanted to adopt technology. We heard yesterday from the Health Minister and the Director General some of the challenges that the Maori population face, the challenges with being able to access primary care because of the cost associated with it. So I think if we can use cost-effective technology solutions to help patients, many of whom have access to mobile phones, surely that has to be a good thing.
What do you think, though, is the biggest hurdle for GPs in terms of digital healthcare?
I think where it is quite quick to get used to digital healthcare. People often have a mental hurdle because they think it's going to be very different to how they are used to practicing. But in reality, it's not. And actually, it's the wonderful thing about doing a virtual consult. It's a bit like doing a home visit. You're transported into the patient's home. They're often much more relaxed, more comfortable. You can get a lot of visual cues from what you see around you. And so quite quickly, GPs adapt to this new way of working and actually really value some of the benefits it can bring. Of course, it can't replace the need for physical consultation. So, I'd say to any GPs thinking about trying this to give it a go, to see it for themselves and see how it can complement their existing practice.
Thinking about barriers to overcome, what has been the biggest sort of resistance to technologies like Babylon?
I think there's always going to be resistance when you introduce innovation, especially into systems which can be quite archaic, quite stuck in their ways. Sometimes people actually recognize that it's a good idea and recognize that it's good for patients, but maybe the rest of the system can't quite keep up with the pace of the innovation. So maybe funding doesn't necessarily flow in the right way that it should. And all of these things, of course, we must address, but we mustn't let these become a barrier to improving patient care through the use of innovation. And I feel really strongly about that.
Yeah. And I think that's a positive message. I think most GPs will be heartened to hear that the primary driver is about patient care. It must always be about improving patient outcomes. So where would members of the GP profession here in Aotearoa, New Zealand, go to find out more about Babylon?
So the best place would be to go to our website, www.babylonhealth.com. That has a whole range of interesting articles, papers, press briefings, all sorts of stuff which would give them a really good insight. Of course, if anyone wants to reach out directly, they're able to do that as well.
Mobasher Butt, thank you so much for your time.
Great, thank you.
Obviously, lots to learn about for our GPs.
Thanks very much. Thanks.